All right, now let's talk about, as I said earlier, the cavalry is coming. Let's talk about the vaccines. The moment we have all been waiting for is finally here. Vaccines are being approved, vaccines are being shipped. We expect the first shipments as early as December 15th. That is 12 days from now. The Pfizer vaccine shipments we expect to begin for New York City. Moderna shipments a week later on the 22nd. We are working closely with the state of New York on a distribution plan with an important focus on those who have the greatest need and need to get the vaccine in the first efforts. We're going to be working with the state to fine-tune the approach, but what we all agree on is high-risk healthcare workers, obviously absolutely crucial to protect those who protect all of us. And we know from a painful experience how much we have to focus on our nursing home residents and the good people who work in our nursing homes. So those will be among the top priorities, of course. Now, over time, there will be enough vaccine for everyone, but we're going to have to prioritize in waves to make sure that those in greatest need get the vaccine first. This will obviously take months, but we're going to focus on the people who have the greatest needs. We're going to focus on those 27 neighborhoods that were most deeply affected by the coronavirus. We're going to certainly focus on folks who have borne the brunt, like people who live in public housing. But we're going to, throughout this process, work on the fastest and most effective distribution, because the faster we can move and the more we can educate people and the more we can get people involved, the more people who will be safe. Here to tell you about it, representing our health department, which has a lot of powerful history making sure that New Yorkers get vaccinated and protected. So leading this effort with a lot of tremendous expertise to support him, our Health Commissioner, Dr. Dave Choksi.
Thank you so much, Mr. Mayor. In New York City, we don't make small plans. We think big, we build big, and we plan big. And the effort to vaccinate millions of New Yorkers in the months ahead will be, in a word, big. That is why we are calibrating our entire public health infrastructure to this project. This spans science, operations, data tracking, equity, and public communication. As the mayor said, our first priority includes healthcare heroes, those who cared for us in the worst moments of the pandemic and whom we continue to depend on now as cases rise. The mayor also highlighted the people most at risk, including residents and staff of nursing homes. Our goal is to ensure that a safe, effective vaccine gets to everyone who wants it. Doing so will require close coordination, yes, across the entire city, but also with the state and the federal government. And it also requires us to make sure that all New Yorkers have access to the latest information. That's why we're here today. But the process of turning a vaccine into a vaccination will be a challenge, a formidable one. For example, storage requirements vary. The Pfizer vaccine requires ultra-cold storage and special freezers. The Moderna vaccine can be stored in regular freezers. So we're shoring up capacity for both to be prepared. The health department itself currently has the ability to receive, store, and ship up to 320,000 doses of ultra-cold. That's at minus 80 degrees Celsius, as well as millions of frozen vaccines. This is in addition to hospital capacity, and over 50 hospitals have access to ultra-cold storage or will have the special ultra-cold freezer delivered very soon, for a total citywide storage capacity of at least 1.5 million doses. But making sure that we're getting vaccine to the people who are at highest risk from COVID-19 requires data. And we will use our citywide immunization registry to monitor inventory and administration and help make sure everyone gets both of the doses. This registry is like the air traffic control of vaccine distribution. Thousands of healthcare providers are already enrolled in the registry and report vaccine doses, such as for the flu shot. I think of this as the everyday miracle of routine vaccination that prevents so much suffering and already saves lives. But we will build upon this for the COVID-19 vaccine. The health department will track in real time communities that may have a low uptake of the vaccine and pivot to ensure that the vaccine is distributed equitably. Our existing public health infrastructure allows us to work closely with healthcare providers, community health centers, and independent pharmacies across the city. We will be providing everything from technical assistance to resources for storing and handling the vaccine. When we anticipate that more access is needed, we will quickly stand up temporary vaccine centers as well. For instance, these centers will be in pre-identified schools across the city and operated by the health department. They are staffed by trained health department employees, other city employees from other agencies, as well as Medical Reserve Corps volunteers. These sites would serve essential workers initially, but could be expanded to serve members of the general public, getting vaccine to people rapidly and safely. The process is simple. Appointments are scheduled, eligibility is assessed online, and after affirming on the day of their appointment that they are symptom-free, they can show up and receive a vaccination. In 2009, during the H1N1 influenza outbreak, the health department immunized tens of thousands of New Yorkers in temporary vaccine centers just like that one. At one site, almost 6,000 people were vaccinated in just 2 days. But this is a marathon, not a sprint, and there is a long, long road ahead of us. Building trust has to be integral to our preparation, as integral as storage and inventory. So we will also be working closely with our partners, including community organizers, faith leaders, and local clinicians in the coming months. As we get more details, we will be sharing information widely with community partners and the general public through public forums, media availabilities, ad campaigns, and social media. As important as sharing information is, my commitment is also to listen to our community partners, to make sure we're doing everything we can possibly do to be worthy of the public's trust, and make it as easy as possible for everyone who wants a vaccine to get one. Public trust in the vaccine is essential. I think about what it takes to earn the trust of the patients I've cared for as a doctor, starting with listening, communicating the science, and following up. We will bring that same approach rooted in humility, evidence, and compassion to our vaccination campaign. One last note. The media has been extremely important in helping to combat misinformation, whether it was dangerous myths about the measles vaccine or more recently, herd immunity and the effectiveness of masks. I want to thank you for the work that you've done and ask for your partnership to report the scientific facts about vaccines and their safety. Together, we can take this step forward into the beginning of the end of this public health emergency. Thank you.